Hello, everybody, and welcome to Friday Flowers with Karen. How are you all? I'm pretty excited today to do this one. This is an interesting topic we're going to talk about today. We're going to talk about children, okay? So I'm going to do this bouquet. A little background on the bouquet is my friends had gotten a beautiful bouquet of flowers from a local florist, and when it died, I grabbed the sticks, right? Because I didn't have any sticks. So I grabbed the sticks so I could recreate, right? So I've got water. There's already the branches in there. I say sticks, but they're like branches. It's very pretty. I'm going to take this and I'm going to go ahead and put a packet of flower food in there, okay? And we're going to get started. I've got a whole bunch. Here, let me put this in here. I've got the top of the vase all taped off. You probably can't see it, but I've got it taped off. Actually, it was taped off from before. So this is a cheater's way to do a bouquet and make a bouquet last a long time. If somebody gave you a bouquet and you've got this shell, the bones, the skeleton of it, you can recreate it, okay? What you do is you go to Trader Joe's, remember? And you buy some flowers. You buy whatever you like or whatever they have, right? So I'm gonna just go ahead and get started doing this while I talk. I wanna talk about, children. And the reason I want to talk about children is I had a one-on-one session with someone this morning, and it really got me thinking more about this and what, I really want to tell people about this subject. It's a serious subject. So a lot of people think, can you guys see me okay, or are you just too close? Let's see if I can move this back just a tad, okay? You get a close-up of me. Let's see if we can make this a little better so you can see exactly what I'm doing here. Ooh, that might be better. Okay. Better? Kind of? You don't see me, but you see the bouquet, which is fine with me. Okay, if I need to see you, I'll lean in. Okay, so a lot of people think that the drug problem in America is really children from homes that are, poor, in bad neighborhoods. I'm just going to start putting these in, okay? I wonder if maybe you should see a little more of me so we can connect. Okay, that's good. It's good enough. I could fiddle with it all day. So a lot of people think that the drug problem in America is really, with children, is really about poor neighborhoods. People that are less fortunate, right? In bad neighborhoods. And I'm going to say no. I'm going to say that no, that's not true. I'm going to say that if you're born with alcoholism, you are the disease of alcoholism. You are going to be alcoholic whether you grew up in a bad neighborhood or a good neighborhood, okay? And, you see people thrive and excel that come out of some of the worst situations you could dream of. And you see people plummet and just fall through the cracks that you think, oh my God, this kid has everything. Why aren't they excelling? Okay, that's because of alcoholism. So not every child is alcoholic. Some are just troubled kids. But most of the time, I think there's some kind of mental illness or some kind of, boy, that's a really sad one. Let's take that one out because that's already falling apart. I'll do something else with that at the end. Something else is going on usually. And I want to talk about this whole world we live in today, this high pressure, keep up with the Joneses, Instagram, makeup tutorials, gaming, all of this stuff that our kids are subject to. It puts a lot of pressure, right? When I was a kid, we went outside and played. We rode our bikes and we played, and it was still tough. Growing up was still tough. Going through puberty, going through first boyfriends and feeling ugly and unloved and all that shit was still tough. So I gotta imagine it's really, really tough today. And I'm gonna be doing a video for children, not a Friday Flowers, because I don't think kids wanna watch me put flowers together. In fact, probably you don't either. But for me, it's a way to multitask. It's a way for me to get my things done, and I can talk a lot better than just sitting and looking at a camera when I'm doing something else. Okay, so for the parents, I want to talk about this. So in this day and age, you know, we put so much pressure on these kids to excel and do well, and that in itself is pressure. That in itself is going to drive a kid right out of its mind, right? That need to keep up, that need to do well. It's a lot of pressure. So if you have a child who's having trouble and you're not sure what's going on, it can spiral out of control pretty quickly. All right? So the person I talked to this morning has a child who already knows, he knows it, his parents know it, everybody knows it. He has a substance abuse problem, right? So he has a substance abuse problem, and he really doesn't want to drink and use because he knows how much trouble that gets him in. He's still a teenager living at home, and he's trying his best not to drink and use. Now, as I've said before, I'm going to say it again. Alcoholism is a mental health issue. It is not a good and bad behavior issue. And I've switched to the pink roses now. I put in some mums, purple mums. I'm going to go to some pink roses. These look a little questionable. See those? So I don't know how long these are going to last, but they will be wonderful for a day or two. Okay? I put the plant food. I don't know if I even told you that. I put in my little plant food right in the beginning to keep the bacteria out. But let's just do this and see what happens, okay? So children that have mental health issues, just like adults, are trying somehow to make themselves feel comfortable. They feel uncomfortable. They feel irritable, restless, and discontent. And there's a lot of ways that a child will treat that feeling. One way is alcohol. So they might be getting into your liquor cabinet. They might be drinking your liquor. They might be drinking with friends at school. They might be drinking out of their friends' parents' liquor cabinet if you don't have a liquor cabinet, right? So this talk today is more about taking the blinders off. Let's take our blinders off. I know you love your child, but let's take the blinders off and let me talk a little bit about things that you need to keep your eyes open for. Okay? So your child might not be drinking at home, but they could be drinking at a friend's house. All right? So you want to know, did those parents drink? What's their standpoint? Where do they stand with kids drinking? Believe it or not, this day and age, some people are okay with it. They think it's better than heroin, so let them drink, right? That's ridiculous. If your child is an alcoholic addict, it doesn't matter what they use. So if they're not treating with alcohol, they might be treating it with drugs. They might not have any money for drugs when they're younger. They don't have any money. They don't have a job. And so they might be getting the drugs out of your medicine cabinet. Yes, out of your medicine cabinet. Do you know what's in your medicine cabinet right now? Do you have old expired pills? Do you have pain meds from when you had a dentist appointment, some dental surgery? Do you know how many is in that jar? Are your medicines locked up, maybe in a safety box? A safe? You can get these safe boxes with a key at Target. You can get them anywhere. Staples. How secure are your drugs? Boy, these flowers really look shitty. I don't think I'm going to use those. I think I'm going to. I'll use the ones that haven't bloomed, kind of as foliage. But some of these just look downright shitty. So let's do that. Like this one has pretty foliage. I'm going to take the bloom off. I'm just going to use that. So I would secure your drugs. You have even if you don't have troubled children, you have great children. Secure your drugs. Not just for your own child's sake, but for their friends that are coming over and visiting. Do it for the other families, okay? Because you don't know what's going on elsewhere. All right? Okay, so that looks pretty good. I kind of pulled out the dead ones. Those aren't. I'm going to do that with the same. I'm just going to pull off the blooms. I'm going to pull off the ones that bloomed because you see these still have blooms that might open for me. So let's just pull off those that look like crapola. That's a technical term for shit. There we go. Let's stick those around. I don't like the way that looks, those. So secure your meds. Okay, how else can they be treating it? Gaming. Now, gaming seems like a babysitter. And it seems like a real relief when you have a troubled child. And at least when they're on the gaming thing, their GameCube, PlayStation, whatever, they're out of your hair. However, what happens with gaming is this. When you're gaming, you have these supernatural abilities. You can jump, you can fly, everything is in Technicolor 3, 4D. You're saving people or you're killing people, and it's very intense. Right? And you get lost in it. And then what happens is you turn off the game and you go back to your regular life. And it's boring. Nothing is as exciting, right? You walk on 2 legs. You have to go to Ralph's. You have to clean your room. You know what I mean? It's just like mundane life. So that's why kids get involved and addicted into that. All right? So it's more than a lazy kid problem. It's a serious problem. And it's another way, if you don't have a liquor cabinet, for your kid to treat their mental health. All right? Another way for people to treat their mental health, I have some white roses. I'm going to use those. Those look much healthier than the pink ones. Now, hopefully those little pink blooms that are sticking around are going to open. That'd make this beautiful for a few more days, but otherwise those pink ones really suck. Anyway, so another way to treat your irritable, restless, discontent feeling is eating disorders, okay? Now, a lot of people think eating disorders are strictly for girls, and they're not. When I ran that treatment center, I gotta tell you that I had more, at one point, more boys, I'll call them boys because they were under 30. That tells you how old I am. Anyway, I had more boys, more men that had eating disorders than women at one point. So do not discount your sons or your grandsons, if you're watching this as a grandparent, from eating disorders. It is another way to treat your mental health. It's not a good way at all. And there's a whole nother bag of tricks that come with that. Cutting. If you, a lot of people that I've seen stop eating disorders, start cutting, okay? Self-harm acts. There's a lot of ways. Now, these kids are not in Compton or Harlem. I mean, some may be, but most of them are in lovely homes with lovely people, and it's going unnoticed. People just think their kids are being irresponsible or rebellious. You really need to look and see, is that the truth? Talk to the teachers, right? Find out what's going on with your kid. Now, what do you do if you've got a kid like this? Well, it's problematic because just like an adult, You cannot help a child does not want help. God, these roses are falling apart too. God damn it. Oh my God, look it. They're just, it's like a wedding. I'm a flower girl. That was worthless, so let's let that one go. Move on. So children, like adults, if they don't want help, it's going to be really hard to help them, okay? So you really have to do, depending on their age, you really have to do a tough love move with it. Try to get them help. Give them some options. If they're living in your home, instead of letting them run amok and torment everyone in the family, you might need to write a contract, right? Until you move out. I get it. You want to drink and use and party all night, right? Until you move out, this is what we're going to do. These are the rules of my house. And a lot of people are like, wow, that sounds really harsh. Well, trust me, this thing can get so out of hand that if you don't nip it in the bud right up front and say, okay, you don't want help, you don't want any kind of advice, opinions, you're not willing to let us get you some help for this. Obviously, you've got some kind of problems going on here, right? So if not, well, then these are the rules. Now, it's not hard to come up with rules because it is your house. And you have to decide what the rules are. You might be very lenient compared to another family, and your rules might not be that harsh. It doesn't really matter what your rules are. What matters is the consequence that goes along with them. So if you set up some rules, I'm just going to say this, I'm not telling you what to do in your home. And if your child already has a therapist or you have a therapist, go over it with your therapist. But let's say your rules are, you got to be home by 9. Maybe for a younger child, you got to be in the house at 8. You got to be in bed. There's no drugs in my house. Look, this was left over from the last bouquet. Let's see if we can put this in here somewhere where it's just looking sad. I'm not done yet. Don't judge me. So, make it look professional with this thing, whatever it is. Okay, that looks pretty. Okay, there it is. I only have one. Okay, see, I put that right there. Let's put some more things in here. Let's put these in. I love these. I've used these before. I don't know what they are. What are they? Veronica. Aren't they cool? Anyway, the consequence, you got to be, there's no drugs and alcohol in my house. If you're really having a problem, you might drug test. Get some drug tests from the pharmacy or from your therapist and order them, whatever you need to do, and get some drug tests and say you will be drug tested randomly. And if you are using, while you are in this house, if you are intoxicated, or maybe you're okay with them using as long as they don't bring it in the house. I don't know what your shtick is. So they have to do their homework. They can't bring friends home without prior approval. I'm telling you, sometimes I work with people and their kids are coming home at 2 in the morning and they're bringing 5 friends. One of the friends hops in the shower. The other 2 are making nachos. There's a whole family of people there, other children that have to go to school in the morning, and these guys are running the house, right? You don't have to live like that. You're paying the rent, you're making the rules. The problem is people make rules and they don't have consequences. You must have consequences. Do we have a guest in the studio? I think my friend Nancy just walked in. And she doesn't want to be on camera, so she's going to pretend like she's not here. Hi, Nancy. So the biggest problem I think that people have is in making a contract with your kid. The problem is you've got to be able to enforce the consequences. So if you cannot enforce consequences, don't even bother making a contract with your kid, okay? So somehow you get this contract made, and I would not just have your kids sign it, you sign it, have your husband sit down, your wife sit down, they sign it, Have the other kids in the house sign it so they're not all of a sudden trying to cover for them. Everybody is very clear that if this does not happen, this is what's going to happen. Now, you say to me, well, what's going to happen, right? What do you mean? What are we going to do? Well, maybe it's if you come home loaded with 5 of your friends, like you have been, I will call an Uber. It will pick you up. We will have a bag packed in the closet, so just in case this happens, you get to take that bag, get in the Uber, and it will take you to the local mission. And then put what local mission it is, so they know you're not kidding around. Look ahead, right? Figure out where you're sending them. I know this sounds terrible. This is horrible. But if you do this right, you won't have to do this, okay? So you look into this, you figure out where they're going to go, where you're going to send them if they don't obey the rules. And that's Nancy's phone, isn't it cute? It's okay, we don't care. So you want to find all that out, and you want to put it down specifically. If you don't obey the rules, the Uber will come, it will take you to this place, and that's where you will stay, period. Now, if you can't do that, maybe it's that you want them to, Grandma and Grandpa are going to come pick you up, and you have to go live with Grandma and Grandpa. That might not be a consequence to a lot of kids. That might be a bonus to get the hell away from you, right? So you got to think about what's going to be. Okay, so I really like this, but I don't like it with this bouquet. What do you think? I don't know. I think this might be more. This might be more the one. I think so. That's going to be something else. It's a very interesting color. I wonder if you can pick up the color on the camera. Look at that. It's very paprika. It's beautiful. But it's a little strong, I think, for my root bouquet. So that's the deal. You want to think of consequences. I don't think taking your laptop away or taking this away, I don't know if those are big enough consequences. You're going to have to decide that yourself. As far as gaming goes, I know this is a tough subject. You might say, well, my kid doesn't have a gaming problem. It would still be a good idea to have some gaming rules around that, some time limits. You can game between this time and this time, and you can whatever that is, after homework, when friends are over, whatever it is, but putting a time limit on it, because they can be up all night long. Do you even know if they're up all night long? Would you know that? I mean, parents nowadays, we have to work, we have to do everything. We're trying to keep food on the table, pandemic. We're all struggling with different shit, and you hit the pillow and you're like, I'm in bed, I'm asleep. Do you know where your kid is? Did they just crawl out the window? You know what I mean? You gotta think about this stuff. I mean, it's nice to think this stuff only happens in bad families, but that's not the case. So, if you want help writing a contract, I have information on that on my website. But don't do it unless you can do the consequences. Okay? So, where can you get help for your kid? Contact the school. Talk to the resource people. Talk to counselors at school. See if they'll give you information. You can go, there's a million places you can find help. If your child does want help, you can find the help. Now, what do you do if your kid doesn't want help? Get help for yourself. You're going to need it. So check out Al-Anon or Nar-Anon family groups. Just Google it and go and listen. And if you think, well, this doesn't apply. These people's kids are on heroin and my kid's just doing gaming. It's all the same, and you're going to need this support. So the best thing you can do is find support for yourself. You don't know what's coming down the road. I've talked to a lot of parents before that, I said, this is going on, this is what you can do. And the other kids in the house, this is what's coming down the pike. And sure enough, that's what came down the pike. And they were so happy they knew ahead of time. And I know people say to me, I don't want to hear this. Like, this is not my kid. Why are you saying this? This is terrible. This is so negative. Well, trust me, you're going to want to know And if not for your family, for someone else. Maybe your nieces and nephews, maybe your sister-in-law is gonna call and say, oh my God, we've got a problem. And you're gonna be able to say, hey, I got some ideas, right? I've got some information. And that's priceless when you're in crisis. To have someone have something to say besides, you know, kick them out. You know what I mean? I mean, it's easy to say until it's your kid. Not so easy to kick out kids. Or maybe it is. You know, it depends how far down the road you are with this. So you want to get help, but most definitely, until they're ready for help, you want to get help for yourself. Okay, so you can keep your head about you. If you do have other children to take care of, you got to pay attention to them. The biggest problem with these families with one addict, all the rest of the kids get brushed aside, right? Because they're good, because they don't take any time. One kid's taking all the attention. Well, you need to make sure that doesn't happen. You need to make sure that there's time for all the kids. And that'll really piss off your addict if you ignore them for a while. So those are kind of some tips and trades. Remember, it's your responsibility to know what's in your medicine cabinet. Lock it up if you need to, not just for your kids, but for their friends. You don't know what's going on in their homes. And God, this turned out pretty good. It's kind of wild. Doesn't look so, my bouquets don't look so refined as the one that come from the florist shops, but they are unique. See this one, this rose just fell apart too. Isn't that a shame? The roses weren't as good for some reason this time. The white ones are hardy. I think these little pink ones are gonna open up though. I think it's gonna be really pretty. So let's see, where am I missing a little piece? Have it right over here. Anyway, if you need more help, please contact me. This is a very delicate subject. I'm going to be doing later this afternoon an actual video for the children. I know, not going to be Friday Flowers because kids are going to think I'm really old and very Martha Stewart-ish. What a compliment. But I'll do one for the kids and see if I can't. I think if children are very smart. If they knew what was wrong with them, I think they'd be totally open to treating it. They don't want to suffer. They don't want to feel bad, you know? And it's so hard when you don't want to listen to your parents. You know, the last thing you want to hear is your mom. Okay, what do you think, guys? Beautiful, beautiful recreation of an old bouquet. I like it. All right, thanks, guys. Let me know if you need any help. Love you.